Tell me a little bit about who Dr. Sarah Friend is.
I'm a medical oncologist who specializes in breast cancer. So MyFriendMD is a virtual platform where I offer one-on-one cancer coaching.
You focus on breast cancer, but you can cover most any cancer?
I can definitely pull up guidelines and help interpret path reports from other cancers as well.
Your website mentions survivorship, wellness, family support. Is there anything else that you can provide support for?
Yeah, absolutely. And survivorship is really important because there's often the fear of recurrence with each diagnosis of cancer. If you need that additional support, just know there are people and resources that can provide it. So don't just accept anything. Make sure that you do your homework and your research and come up with a treatment plan and a network that really does support you and your wishes.
Sarah, thank you for joining me today.
Thank you for having me.
Yeah, absolutely. So before we get into what you're doing now, tell me a little bit about who Dr. Sarah Friend is.
So my name is Dr. Sarah Friend, and I'm a medical oncologist who specializes in breast cancer, and I've been in Atlanta since 2016.
Where in Atlanta were you practicing medicine?
I started in 2016 at Emory University, and I was there for about 8.5 years. Loved my practice, and I had a focus in breast cancer, which is my subspecialty, and that's the area that I treat most of.
Okay. And what originally got you into medicine?
I come from a family of doctors, so both my father is a doctor as well as both of my grandparents and now a lot of my cousins. So I grew up learning all the medical lingo, and when I went to college at Emory, I recognized that I just sort of naturally gravitated towards the science classes, and I just enjoyed it. So I decided on medicine in college.
Do you think that it has anything to do with your name and being Dr. Friend, and that's just like the perfect name for a doctor?
For sure. So actually, my maiden name was Cook. So there's lots of Dr. Cooks in my family. So when my boyfriend at the time was last name Friend, he actually made the comment to me, if we get married and you go to medical school, you'll be Dr. Friend. And I was like, oh, you're so right. So we did actually end up getting married. And then I did take his name, Dr. Friend. And a lot of people have said that. Actually, my first day of practice, before I'd even seen any patients, someone in the elevator saw my badge and they said, I want to be your patient because of your name. And I was like, ma'am, I've never seen, I didn't say that, but I was like, are you sure? So yes, I have gotten good feedback on that name.
And you recently made a pretty big change in your entire career. Tell me a little bit about why you made the decision to leave Emory.
Yeah, so I love Emory, love my patients, love my staff, loved the job. I recognized that I was a really good 1-hour doctor. And when follow-up, so for your first patient visit, you get a whole hour where you can really dive deep into issues. And for your follow-up visits, it's 15 minutes, at most 20. And I recognized that I needed more time per visit because there were more questions patients had, and I didn't have the time to give to them. So I started thinking about how I could make this better, where I recognized if I just had hour-long sessions, then I would have time to answer all 20 or 25 questions and give some the space to answer follow-up questions beyond just the initial diagnosis and the treatment plan. Let's go deep and really explore the issues. So it came from my recognition that I always felt like both my patients and myself were more satisfied after each visit if we had extended visits. And the only way to do that was if I changed the model for my own practice altogether, offering 1-hour sessions as opposed to 15-minute sessions.
So then MyFriendMD was born. Tell me a little bit about what is MyFriendMD?
So MyFriendMD is a virtual platform where I offer one-on-one cancer coaching. So someone can book through my website a one-on-one session with myself where I can investigate which questions they had, and we go as deep as they want to on every single issue and topic. So people who may use this would be someone who was just given a new treatment plan by their medical team and just wants another person to bounce ideas off of, and may feel overwhelmed by the diagnosis and want someone to help them create a question list that they can then bring to their doctor to make sure that all of their issues were addressed. So The MyFriendMD platform is a support service made for breast cancer survivors, but technically any type of cancer, to book and allow me to just answer whatever questions are important to them depending on their stage of journey, whether it be early on, midway through, or even in survivorship.
Okay, so you said you focus on breast cancer, but you can cover most any cancer if they have that interest.
Yeah, so while breast cancer is where I focus most of my time, and that's where most of my practice has been devoted to, but having still understanding of the terminology and the basic gist of the other cancers, I can definitely pull up guidelines and help interpret path reports from other cancers as well. So I can be useful, but I wouldn't promote myself as a lymphoma expert by any means.
Is there any other conditions that you do coaching for, or is it specifically cancer?
That's actually a really good question. And I was recently asked to talk to someone who has low iron. So I'm a hematologist and oncologist. And as the hematology piece, I also can talk to people with things like iron deficiency anemia, low platelets, B12 deficiency, and other blood issues. So technically, I am a hematologist and oncologist, so could talk to people with both blood issues as well as oncology.
And as far as I understand, the hematology piece from you kind of came from your own diagnosis. Is that correct?
Yeah, I recognized I had a clotting disorder in medical school. And so when I would learn more about my clotting disorder, I naturally gravitated towards the hematologists in my training. So I would tell them that I have a clotting disorder, and they thought it was cool and would let me read the studies on it and help see patients that had that. So I recognized, okay, yes, it's annoying to have a clotting disorder, but learning about it was power, and I was able to get treatment when I needed. And it was actually really helpful in shaping my career path. And then as I gravitated towards the hematology piece, the oncology training came along with that. So I was able to get trained in both. But you're exactly right. That's how I initially became mentored by the hematologists in my organization.
So you learned about it in medical school.
Mm-hmm.
Was that reading a book and then you went, wait a second, that's me?
Yeah. So my father was diagnosed with a blood clot and was hospitalized. And this was in Florida, and he was hospitalized in Florida. And the rounding pulmonologist said, I did some tests, and you actually have a disease called factor V Leiden. And when I was in medical school, my doctor at the time said, you know what, I know about this disease that your dad has. There's a chance you could have it. And I was like, yeah, I'm sure I don't. And I just was like, there's really no need. I don't have that. And then I got tested and found that not only did I have it, but my dad was what we call heterozygous, which means one bad copy of the gene. I was homozygous, which means I have two bad copies of the gene, which then told me that both my mom and dad have the gene, which I quickly didn't believe, said the test was wrong. So they repeated it, and I do have the gene. And then I said, well, the only way that can be true is if mom has it. So we got mom tested. Mom has it. Yeah. So I'm rare, and both of my brothers are what we call heterozygous. So they have one bad copy, one good copy. I have two bad copies. So that scared me initially and was not very fun thinking I had that. But then at the same time, as a hematologist, I treat people with that. And I recognize that it's treatable, it's something manageable, it's not the end of the world, and that has been helpful.
So you've got the hematology side, the oncology side. I understand you're triple board certified, right?
Yeah, I am also internal medicine trained. And that was the first few years of training was internal medicine. So general medicine, diabetes, high blood pressure, things like blood clots, like you would deal with a clotting disorder. And then I went on to subspecialty training, which included the hematology and oncology piece.
Okay, so you can cover a lot of different things clearly under MyFriendMD for the most part.
Yes, I would, again, not promote myself as being expert in everything, but when it came to questions that were both internal medicine as well as oncology, just like weight loss drugs and the GLP-1 inhibitors, and I was able to rely on some of my network and resources for certain interviews to sort of discuss the way that obesity medicine is also impacting cancer care. So there are times when having that training comes in handy as well.
When should somebody book an appointment with MyFriendMD?
If someone feels like they have a lot more needs than their office visits, and if they leave their doctor feeling like, oh my gosh, I need someone else to talk to, and they feel like the resources that they have, maybe in their family or in their communities, aren't giving them what they need, or they think they could use that additional support. So MyFriendMD does not see patients independently of the healthcare system. It's a platform used to support the medical system. So you keep your doctors. I would just be someone to talk to you outside of that on your time. So it could be nights, weekends, after work, and we'll unpack sort of what's going on and how we can support you depending on your part in the journey, or depending on where you are in your journey. So if somebody has a new diagnosis and they're very scared, I could talk to you then. Or if somebody has been on the estrogen blockers for many years and they're contemplating stopping them because of side effects, I could talk to you then. And let's talk about the risk of your disease recurring and whether or not you should consider that. So even in the stage 4 setting, I could offer valuable guidance. But again, it's not mandatory to have this, but if it's something that you think you or a loved one could use an extra hour of time with somebody to talk about the disease, then I would say that's the right person for me.
And you've said your mission is to treat the person, not the disease. What does that mean?
Well, there's often outlines where we say we're going to make it our goal to make you live as long as possible. And I think that's super important. And I love that we have overall survival as a clinical outcome for a lot of our studies. But I also think let's talk about your goals of care and your personal preferences. So for someone who may say, especially when faced with a life-threatening illness, that they may prefer the more gentle treatment, even though the more harsher treatment may make you live a month longer, that's a choice that you should be given. And I think that if you can soul search on your own goals and wishes, and if you can be clear with your medical team and your family to say things like, this is what's important to me and this is my priority. I do not want to lose my hair, even if the treatment that is most effective could allow for hair loss, even permanent hair loss. That's a conversation that needs to be had, and you have the choice and the right as a patient to make that choice. So I think that if we narrowly focus on survival, we're going to probably give you the most effective treatment, which may come along with additional toxicities. And if those toxicities are not a risk you're willing to take, that conversation needs to be had. So that's another thing that we can talk through is like, well, why are you not wanting to do the treatments? Your doctor recommended it for a good reason, but like, what are your concerns? And sometimes your concerns mean that there's another value you have that's more important than living as long as possible. You want to live well. And I think that's valuable. But I think that sometimes you're afraid of a treatment and then you don't do it. And then the disease itself gives you the side effect you were worried about with the treatment. So I've seen that. And so I think it's really important before you elect to forgo a different option to make sure you're clear on the risk and benefit and the percent of side effects that you could accept or that you could expect.
All of those questions, all of those concerns seems like an impossible task to answer in 15 minutes.
It's not possible. I mean, you don't have time to do that in 15 minutes. So either you are relying on question asking later, or you're having multiple visits with the same care team regularly, or you're, relying on Google or a friend who may or may not have exactly what you have. So the conversation may not be as accurate if you have it with someone who has a different type of cancer than you. So you may be making a decision based on input from a source that may not be right. It might be, but it might not be your exact case. So it's one of those things that I felt strongly was problematic with my own personal practice, that I didn't have the time to give people what I thought they needed. And that was the reason I think there's a need for something like MyFriendMD, because unless you're really, really, really efficient and get those questions answered and feel totally confident, I think there's a need for outside support.
Why do doctors only meet with patients for such a short period of time after that first initial meeting?
I think it is based on how long you've been in practice and how many patients you have. So when I am new and I start a new job, my template is wide open. So if your questions aren't answered, that is not an issue. I can see you Monday and Friday and next week. But once you've been in practice for, let's say, 5 years plus, your template is pretty full. And either to accommodate new patients, either you start opening up your lunch break, start shortening your slots. So the institution may not tell you to do that per se, but if you have a 20-minute slot and you know that you need to see about 3 more patients per day, you may cut those slots down to 15 minutes just to accommodate them. And so alternatives to get people seen quicker may be to hire additional support. So we have a great team of physician's assistants, PAs, as well as nurse practitioners who can help see patients with us. But if you want to see your patients regularly, then the slots are going to have to be shorter to accommodate more patients per day. So it's really a vicious cycle where it's impossible unless you have just protected time where you can see them on different days, but often you don't.
So if somebody sounds like, well, that sounds exciting, an hour-long session sounds a lot better than 15 minutes. Does MyFriendMD, do you do any sort of procedures, prescribing drugs or anything like that?
No, and that's a great question. So through MyFriendMD, the assumption is you're still keeping your doctor. So you're keeping your physician who's ordering your test and ordering your mammograms and doing the prescriptions and the writing, and we are strictly support. We are to help prepare and educate about your disease so that you can make a decision that's right for you. So if you feel like based on your energy level, you want to be on oral iron, as an example, that would be a question list that we would make ahead of time, and your doctor would be the one to order those tests and would be prescribing it if it's something you needed. So preparation, education, and empowerment is what my platform is all about.
Amazing. And how do you work with their doctor or their medical team?
So we work in conjunction. So if it's a physician who feels like they have a patient who needs additional support, I'm happy to communicate with the doctor and come up with a treatment plan and collaborate. And so I'm not working against doctors, and I'm not working against the patient's care team or their plan. I'm working with them. So I'm an additional level of support that can help explain things a second time if needed. So they may have gotten the perfectly appropriate treatment plan, and then they just might need a little more time to digest the idea of taking that medicine with side effects. And I'm here to help help explain the plan that the care team has made.
So there's so many layers of even cancer diagnosis, let alone the treatments.
Exactly.
And going through all of that can be very confusing at times. Is that kind of the sign that people should give you a call or book a call when they feel confused? Is there any other?
Absolutely.
Somebody out there might be on the fence?
Yeah. And someone that just wants more clarity and wants a treatment plan and help navigating the cancer world. Absolutely. An abnormal mammogram, an abnormal biopsy, questioning a really big decision that has to happen soon. I'm definitely happy to help with that. The type of surgery, the side effect management, all of that, I would be a asset if that's a need that the patient felt.
Can a caregiver book an appointment with you?
Yeah, actually, if a caregiver wants to know, hey, how do I, how can I best support this person going through? Absolutely. I mean, I have caregivers a lot who ask me very specific questions about the disease and how they can support their loved one. And there's no reason that we can't delve into the best way to do so.
Your website mentions survivorship, wellness, family support. Is there anything else that you can provide support for?
Yeah, absolutely. And survivorship is really important because there's often the fear of recurrence with each diagnosis of cancer. And so within that context, things like maintaining a healthy body weight and exercise, including both cardio and weight bearing, and eating healthy, all of that is part of survivorship, and just along with the medications can help to reduce your breast cancer bad outcome. So it's really, really important to have a really good conversation with your oncologist about survivorship, and we can definitely have that as well. Both monitoring for disease recurrence and mitigating risk factors to reduce your own recurrence. So survivorship is equally as important.
So patients can send medical records ahead of time. Is there anything else that they can do to kind of prepare for the call with you?
Yeah, after booking, there's an intake form, and figuring out exactly what you want out of the visit is helpful. So specific questions that you might have and your understanding of your disease. So I'll ask an intake form like fill out the type of cancer you have and what's your stage and what exactly has been told you already about your disease. So it's a very tailored program towards your needs.
Can you give an example of any time that your advice or a call kind of changed somebody's plan or maybe helped them make a good decision? Do you have any examples of that?
Yeah, I was asked to speak with a patient that came from another doctor who said, the patient had some additional questions, and I know this is your specialty. She would like to book a session to really delve into the risk and benefit of additional extension of the treatment versus stopping it early. And we went through all the data, and it was great. It was fun because we could have the time to go through all 5-6 studies. And at the end of it, she felt like she was heard and she felt like she had good information to make a decision as to how long she was going to be on the estrogen blocking pills. So it was something that her doctor felt like was helpful and was needed, because that conversation is really hard. You feel like you might be giving up some percentage points of survival if you stop early, but at the same time, 3 to 4 more years of side effects might have its own problems. So after our conversation, she was able to make a decision, or at least feel better about the decision she was about to make. Without there being a right or wrong, it was absolutely her choice, but we were able to come to a decision that was good for her. And she still could change her mind, which is totally fine, but she was able to take that information and go to her medical team, and I received good feedback from her provider.
Well, the way your face lights up when you talk about a patient or a client is, I think, a good example of the fact that you're doing good work and that they're getting good work. What are the long-term goals for MyFriendMD? What do you want it to become?
I want to subspecialize to be able to address everyone's needs depending on what they are. So I would love it to start to create courses, and that's something I'm working on, to help educate on various steps of the journey. So things like initial diagnosis and, the things you should know as soon as you're diagnosed, and the things that should come into your treatment decisions, like lumpectomy versus mastectomy versus bilateral mastectomy, as well as a whole session on the estrogen blockers and really going deep on exactly what they are, how they impact your disease, and, decision making for duration of therapy, 5 years versus 7 years versus 10 years, as well as education on different stages of disease. So I would love to be in the future a resource for people, even if you're not booking sessions with me. But if you find that the conversations that we're having on various topics are helpful, then I could be a resource for you. So I'm working on the education piece at the same time as I'm building this, and hopefully I'll scale and bring in other subspecialists to not just talk about breast cancer, but talk about different types of cancer and maybe even other things like obesity and health and nutrition and even integrative oncology. So all those would be my future visions.
Amazing, amazing. Over your career, what has been your observation of the value of community when patients are going through any sort of hard time, or hard diagnosis, or hard treatment?
So important. So important. Having that extra person who can drive you to your appointments, who can walk your dog when you can't, who can, make you dinner. It's really important because everyone's going to need an outlet, and specifically a supportive outlook, or a supportive outlet who's not going to let you down, And so I think that there's a degree of loneliness with this disease, a feeling of isolation, of fear, and a lot of difficult emotions, and maybe even PTSD. So having a support and people that you can trust and talk to is not only helpful for your mental health, but also your physical health.
That's amazing. Is there anything else that you want people out there to know about MyFriendMD, or maybe their cancer journey, or anything along those lines?
Yeah, I think that just if you wanted to check out my website, it's myfriendmd.com, and I can also be followed on Instagram at SarahFriendMD. And I would just say that if you need that additional support, just know there are people and resources that can provide it. So don't just accept anything. Make sure that you do your homework and your research and come up with a treatment plan and a network that really does support you and your wishes.
Sarah, thank you for joining me today.
Thank you so much.
Thank you.